Today our topic is antiviral drugs. Okay. Here what are all the things we see is that what is the two life cycle of virus. Okay. What is the mechanism of action, how drug acts, how antiviral acts, okay, and again what about the side effects, okay, and different types. For DNA virus you have an example, for RNA virus, for reverse transcriptase, okay, you have examples for all these viruses. These are all the things which you will be seeing in this topic. Fine. Yes. So, what is a virus? It is a small infectious agent that replicates only inside the living cells or any other organisms. It can only replicates if only it gets attached to the any other living organism. It can, virus can infect all types of life forms, from animals and plants to bacteria. So, virus is a small infection agent that replicates if only it gets attached to any host organism. It can attach to any host organism, from plants, from animals to bacteria. Fine. Yes. So, virus particles we call it as virions. Okay. Yes, it is just a refreshment of what you have learned. Yes, it is just a refreshment of what you have learned. The thing is, you will be learning about the drugs, okay, where it acts. Okay, you have different stages at where the drug acts. Okay, that's the only new thing which you will be learning under this topic. Rest all virus life cycle, what are all the different types of virus, all this you must have studied in your earlier sessions or in your earlier classes, right? Yes, virus particles, it is known as virions. It consists of 2 or 3 parts. Okay, the first part is the genetic material. The genetic material may be either DNA or an RNA. You have the next part would be a protein coat that protects the gene and an envelope of lipid that surrounds the protein coat. These 3 parts you can find it in a virus. The first and the foremost main part is the genetic material, either a DNA or an RNA, a protein coat which protects the genetic material, and a lipid coat. Yes, these are all the 3 parts which you can find in a viral structure. Here you can see the viral structure, it is not clear. Once it is put it in your server, you can find it clear, but still here you have a capsid, surface protein you have, here you have this viral, here you have this viral envelope, and this is your genetic material, virus genetic material, either DNA or RNA. This is the structure of virus. It consists of 3 structures: genetic material, a protein coat, and a lipid coat. These are all the 3 main structures or parts which you can find in a virus structure. Yes. Next comes types of virus. Based on the sizes and shapes and based on the genetic material, we have different types of virus. Okay, size and shape we call it as morphology of virus. Okay. Virus display a wide diversity of shapes, we call it as morphology. In general, viruses are much smaller than the bacteria. It has a size range diameter of 20 to 300 nanometers. Some viruses have total length of up to 1400 nanometer. The diameters are only about 80 nanometer. So, based on the sizes as well as the genetic material, you have different types of virus. Size and shape, it exhibits wide range of size and shapes. It is called as morphology of virus. Here you can find, based on the shapes, isohedral, helical, prolate. These are all the different sizes and shapes of virus. Okay? Yes? Yes. Now we come to the types of virus. DNA virus, example is your herpes virus. Okay? Under herpes also you have 2 types of virus, herpes simplex virus 1, herpes simplex virus 2. Okay, we will be seeing in detail when we move on to the next slides. Okay. So, for DNA virus, example is your herpes virus, RNA virus, you have influenza virus, reverse transcribing virus, you have retrovirus. Yes, clear? These are all the different types of virus. You have an example for DNA, RNA and reverse transcribing virus. We will see one by one. Fine. how this viral replication it starts. A virus cannot replicate on its own, it must attach to your host cell for replication, then it uses the host cell energy to synthesize the protein, DNA and RNA. There is an integration of the genetic material of the bacteriophage to the host cell bacteria. Got it? Yes. Viruses are difficult to kill. Why? Because it enters a cell. Once you target the virus, that drug it targets the normal cell also. It may damage the normal cells. That's why it is very difficult to eradicate a virus. Fine. As I told you, in life cycle of virus, there are two life cycles. One is lytic, lysogenic. What do you mean by lytic? Lytic, lysis, right? Lysis of the infected cell, infected cell membrane or the cell wall. Yes, there is a lysis of the cell wall or the cell membrane of the infected cell. Lysogenic. How reproduction take place? Integration of the viral bacteriophage genetic material with the host cell bacteriophage, host cell genetic material, and thereby there is a production of replicons, circular replicons by which it is going to replicate. First one is lytic cycle. In lytic cycle there is a lysis of the infected cell walls, infected cells, cell membrane. Yes, yes, bacteria or any living organism cell wall, there is a lysis. Next one is here lysogenic. Yes, lysogenic, there is integration of the genetic material of the bacteriophage to the host cell bacteriophage, so that there is a production of circular replicons, thereby it replicates. Fine. This is the life cycle of virus. Want me to write? No need, right? Yes. Yes. I hope this also virus, there is an attachment to the host cell. 2, uncoating of the virus takes place. 3, control of the DNA and RNA of protein production, production of your viral subunits, assembly of virions, and then it is released to the other cell. Okay. Here the site of action of drugs. Okay. You are going to kill the virus. Okay. So that it does not enters into the other cell and damage the cells thereby. Fine. So, when you get a viral infection, if you are immunocompetent, yeah. You want me to go to the lines? Yes. Yes. Yes.
Before going to the other organ. So, how can you say that if it is, if you don't know how much time it takes to enter into the other organ, so how can you do that?
Again, viral therapy is prophylactic. Once you get the symptoms, when we proceed with the slides, you will understand better. Because once with the symptoms, for example, herpes simplex virus, you can detect the virus before the eruption of blisters in the here in the mouth area. You can go for a prophylactic treatment of antivirals, so that you are going to prevent it, you are not going to cure it. Once it enters into your body, it stays there inside your body. Once your immunity goes down, that time only it comes out. So, you go for a prophylactic antiviral therapy. Once the symptoms, if you know about the symptoms, you go for the prophylactic treatment. You go for antivirals, so that you prevent or you just prevent the viral action. What you call is that the aggressive nature of the virus can be prevented. You cannot completely eradicate the virus, no. To some extent the aggressiveness can be inhibited, so you go for a prophylactic treatment.
So directly you are reducing the replication part?
Yes, that's how you are going to reduce the aggressiveness of the disease. Otherwise it spreads throughout the area. I am giving an example for herpes virus. It happens with all viruses also. Okay, once you get a eruption, once you get the numbness, because they know they have already prone for this infection. Once they would have got this, next time when your immunity goes down, that time they will be getting this blisters, cold sores, herpes simplex virus. It is otherwise called as cold sores. Okay, once the symptoms they get, they go for the prophylactic treatment, or they go for any topical application of some antiviral ointments. Got it? Yes. Yes. So, when do you get a viral infection? When your immunity is very low. Yes, you get it in, if you have a competent immune system, you are not going to get any viral infections. When your immunity is immunocompromised, in cases of AIDS, HIV infection, when after a transplant, any organ transplant, the immunity will be down. That time they are immunocompromised. That time they are prone for getting viral infections. So, okay, if you are immunocompetent, you are not going to get the viral infections. When your immunity is down, if you are it is for immunocompromised patients, they are prone for getting viral infections. Okay, immunocompromised infection, no patients. You have certain types of tumor, lymphoma, that time you are prone for viral infection. Transplant patients, any transplantation has been done, they are more prone for viral infections. And in cases of AIDS patient, these are all the people where they are more prone for getting viral infection. Yes. Oh. Okay, I'll still. There are different types of virals. Virals at present we can control some of the virus, that is cytomegalovirus. Yes, cytomegalovirus, herpes simplex virus 1 and herpes simplex virus 2. Okay, retroviruses. Okay, retrovirus is your reverse transcriptase enzymes virus. Okay, all these viruses can be, as of now, it can be controlled by antivirals.
Actually, in AIDS, the main thing first when we get the disease, they are saying that the shape of the virus is going to be different now. So how can you prevent that? Because we don't know if one after it is different shape, another cell is different shape.
Okay, once you have detected that it is a virus, yes, okay, you have some diagnostic parameter to find out in which stage they are. We call it as cluster of differentiation, CD4 cells. I hope you know that. Okay, it is nothing but a WBC cell. Okay, it's going to give a signal when there is any intruders. So based on the stages of their CD4 cluster of differentiation level, you can treat them. So based on the disease condition again, whether they are in the early stage or in the later stages of their infection, you can treat them accordingly. Even if it is going to change their shape, or even if it is going to go for any other variations also, you can, based on the CD4 counts, you can treat them. Accordingly, you can find out the stage and you can go for an antiviral therapy. Yes? I told you, it's only preventable. You can reduce the aggressiveness of the disease. It is not going to cure your disease. Most of the viruses are like that. Your type A hepatitis B virus, once it enters into your body, it's going to stay in the liver. Yes, and once if your immunity comes down, it's going to trigger. That happens with all viruses. Even for chicken pox, as of now, we don't go for any medication. That's what, it's not, we cannot say that it is completely eradicated. You have become, immunocompetent. You have, once you get, even now smallpox, you hear somewhere that they have got some. You have your own WBC cells to fight against it, right?
Yes, ma'am. Actually, everybody has having, but even though we are getting these viruses now. So
based on your WBC number, even if it is going to go down because of continuous any bacterial infection, after viral infection also you are prone for secondary bacterial infection. Okay, if you are more prone for all infections, some people are prone for many infections. In that case, their immunity level is down. The WBC level count must be down. Okay, in future also they are more prone for any other infections. We can't predict it. Yes, to boost your immunity also, they go for antivirals, so that you get lot of immunity to fight against that particular virus.
in that case, ma'am, we can put more amount of WBC in our body so that we can become
Again, blood transfusion, segregation of your that's what is happening with your dengue now.
Yes,
They are going to segregate the platelets from the blood and they are going to give the platelet. Again, it becomes, it's a risky factor, right? More than that, you need to improve your immunity. That's why you have, you have papaya leaves, onion, jaggery. These are all the things they say that cures dengue. You know that your platelet can be transfused, but still you go for a natural remedies like this, right, rather than going for a blood transfusion. Yes or no? We prefer going for that and check whether your platelets are going up. Yes, later on only if it is going to drop down more, less than 30,000, then you need to go for a transfusion. Yes. These are all the antivirals. As of now, it is controlled by our drugs. Okay. Yes. Here you have hepatitis A, hepatitis B, hepatitis C. It is based on the incubation period actually. See, A it has 50 to 50 days, B it has 60 to 150 days, and here C 14 to 180 days. Look at the incubation period, it is too long. Yes, that is the severity of the disease. Jaundice, we say it normally as jaundice, but we have to look for which hepatitis A, whether it is A, B or C. Yes, that is the severity of the disease. Incubation period, chronicity in pregnant women, it is, you know, yes, it's a chronic one. Vaccine you have for hepatitis B, you have a vaccine protection which is for 10 years. For lifetime there is no protection. There is a vaccine for hepatitis B, but it can protect you for 10 years, 3 shots. Okay. As I told you, herpes virus also, you have 2 types of herpes virus, herpes simplex virus 1, herpes simplex virus 2. Herpes simplex virus 1 which affects your facial regions, okay. It is present in the trigeminal nerve below your, behind your ear. This one, it is present in the sacral ganglion which is at the lower part of your spine. That is why it affects your genitals, this affects your facial region, okay. These people are more or susceptible for these herpes 2 virus, but these people when they get this one, they get immunity to this herpes simplex virus 1. Getting me? Yes. These people, they are, these people are more susceptible to get the HSV2, but these people, they are, they get the immunity so that they don't get, it is chances of developing a herpes simplex virus 1 is less when they have genital herpes. Got it? HIV, human immunodeficiency virus, yes. It affects all the parts, acute central nervous system, lymph nodes, skin, in gastric, GIT, muscles, it affects all the parts of your body. Again this is, it affects all parts of the body. Here you come, that is your stage 1 HIV, stage 2, here you can find the CD4 which is nothing but cluster of differentiation which is a T4 helper cells, okay, which is nothing but your WBC cell which gives a signal when there is any intruders like virus or bacteria, okay. Based on the CD4 count, you can diagnose a HIV patient on which stage he or she is in, okay. Based on that you can go for your antivirals. Yes, all this you can see, stage 1, stage 2, stage 3, you can find the cluster of differentiation cells, how much is the count, okay. Next, how our antiviral acts? First it is able to enter the infected, the cells infected with virus. Our antiviral, it enters the cell where the virus has been already infected, yes. It interferes with the viral nucleic acid. Second one, some drug interfere with the ability of virus to bind to cells. It interferes the virus to bind to the cells. Some drug stimulates the body's immune system, okay. Best response, how can you get a best response if only the patient or the person is immunocompetent? When you get a healthy immune system, it works synergistically, it works additionally with antiviral therapy, okay. If your immune system is good, it works additional with antiviral so that you can eliminate the virus faster. Fine. All these infections are opportunistic infection. Why do we say that it is an opportunistic infection? Because you get the infection when you are immunocompromised, okay. It needs an opportunity to trigger, okay, occur in immunocompromised patients, infection that would not normally harm an immunocompetent person. It requires a long term prophylaxis and anti-infective drug therapy. Okay. Along with the antiviral, they treat with antibacterials also. Why? Because after a viral infection, chances of getting a bacterial infection, secondary bacterial infection is more. Yes. Here you can find this is viral adsorption, that is attachment of the virus to the host cell. See how where our drugs it goes and blocks. Yes, different drugs it goes and blocks at different levels of virus. Yes. First one, viral adsorption blocked by alpha globulins. Okay, it is non-specific. Then yes, gamma globulins. Yes. Next is this particular uncoating of the viral. Yes, once it attaches to the host cell, there should be uncoating of the virus that is done by amantadine, okay, which causes uncoating. There is, most likely these drugs can be asked in your multiple choice questions. Okay, which drug, where is the site of action? Amantadine, uncoating of the virus, or whether it interferes with your, any other analog. The questions may be asked in this way. Okay, yes. So amantadine, it acts by uncoating. Yes, it blocks the uncoating of the virus. Yearly protein synthesis is blocked by formivicin, which you will be see for what is this CMV? Cytomegalovirus, CMV. Okay, cytomegalovirus. The nucleic acid synthesis is blocked by purine pyrimidine analog, your reverse transcriptase inhibitors. We will see what are all the drugs that comes under reverse transcriptase inhibitors. Okay. Then late protein synthesis, it is blocked by, you have protease inhibitors. Here packing and assembly of the virions, it is blocked by rifampin. Then viral release, it is blocked by neuroaminidase inhibitors in cases of influenza virus. This is how antivirals act. It starts with adsorption of virus to the host cell, uncoating, yes, uncoating is inhibited, yearly genetic synthesis, protein synthesis, late protein synthesis, release of the virus, all this has been inhibited at various stages of antivirals. Got it? Yes. Now we will see what are all the drugs. Yes. Antivirals, first one is your non-retroviral acyclovir. It is a synthetic nucleoside analog. Okay. It is used in the treatment of herpes simplex virus and varicella zoster in cases of chicken pox. Okay. Acyclovir, it is used in the treatment of herpes simplex virus as well as in cases of chicken pox. Yes. Drug of choice for the treatment of initial and recurrent episodes of infection. That is why I told you, once the virus enters into your body, once your immunity goes down, recurrent infections are more. Okay. You have oral, you have it as solid oral tablet capsule you have topical as an ointment base, acyclovir ointment for the treatment of herpes simplex virus, and it is available in the form of parenteral injection forms. Mechanism of action, acyclovir by the help of viral thymidine kinase, it is getting converted into acyclovir gynosin monophosphate. Again by phosphorylation, it is getting converted into triphosphate. Once it enters into the viral DNA, it causes premature chain termination and further inhibition of activity of DNA polymerase. The genetic material, its synthesis of genetic material is inhibited, and thereby the virus, you are going to inhibit the action of virus. Yes. Here you should know the mechanism of action. Everywhere there is a process of phosphorylation. Okay. Phosphorylation takes place in all the mechanism of action, that you have to remember the mechanism of action. Okay. And it is used in which type, whether it is it affects the DNA or RNA, or whether it is a reverse transcriptase enzyme. Okay. This you have to know. Acyclovir. Fine. Next is uncoating inhibitors. Uncoating inhibitors, which drug we have seen? Amantadine, yes. Rimantadine is an amantadine, it's a methyl derivative, okay. It is a cyclic amine, it causes inhibiting the uncoating of the viral RNA of influenza virus with the infected host cells, fine. It prevents the influenza virus, reduce the duration of symptoms when administered with 48 hours of onset. Adverse effect, gastrointestinal intolerance, compliance with the nervous, difficulty in concentration, lightheadedness, these are all the adverse effect of amantadine. Yes. And how it acts? It inhibits the uncoating of virus. Got it? Next is ganciclovir, which is cytobin. It is available in the trade name of cytobin. It is a synthetic nucleoside analog. It is used to treat cytomegalovirus. It is available in oral parenteral forms. Cytomegaloretinitis, okay. It is used as an ophthalmic solution, okay, because this particular virus, it affects your eye. Ocular injection is available, and ophthalmic form surgically you need to, you have a ophthalmic form which is an implant which is surgically kept inside the eye, so that it releases the drug for a continuous period of time, fine. Ganciclovir, again it acts by, it is getting converted into deoxyguanosine triphosphate. Here also phosphorylation, yes or no? Triphosphate, it inhibits the viral DNA and thereby termination of elongation of viral DNA. As a whole, all mechanism of action, it stops the termination of, elongation of DNA and thereby terminates the viral DNA. Toxicity, it causes bone marrow toxicity and renal toxicity. I asked you to go through yesterday's first pass metabolism and one in the newspaper for proton pump inhibitors. Have you gone through? I asked you to go through because it causes renal toxicity and it is the most widely used proton pump inhibitor which causes renal toxicity. Even you can ask, get from down and you can go through yesterday's paper, okay, you get an idea. Foscarnet, this is also pyrophosphate analog, binds reversibly near pyrophosphate binding site of DNA polymerase, inhibits DNA chain elongation, inhibits viral polymerase. Antiviral drugs, non-retroviral. Treatment should begin as early as possible. That is why I said once the symptoms emerges, you need to treat them so that you reduce the aggressiveness of the disease. Fine. Oseltamivir, it is Tamiflu. Have you ever come across bird flu? Oseltamivir, yes, this is the drug of choice. Okay, active against influenza type A and B, reduce the duration of it causes nausea and vomiting. Even this zanamivir, it causes diarrhea, nausea and sinusitis. Once you know about the drug, you should know about the adverse effects of the drug. Okay, but benefit always outweigh the risk. That is why you go for a drug. Benefit should be more, risk should be less. Yes, that is the reason why we go for a drug. Yes. Flu is caused by influenza virus. Virus is a parasite, it needs host cell to replicate, binds to cell in a, so influenza virus, it affects your respiratory tract, okay. The virus is taken into the cell through endocytosis. All this, how this influenza virus, it affects your respiratory tract by uncoating, by integration of the viral genetic material with the host cell genetic material, and it synthesizes its own protein and synthetic material, then it goes to the other cells. That is the mechanism. Reverse transcriptase enzyme or inhibitors. You know what is this reverse transcriptase enzyme or reverse transcriptase? Reverse transcription. You get a template, there is a production, yes, okay. Reverse transcription. That this reverse transcription is the generation of complementary DNA from the RNA template. What is this complementary DNA? Okay, cDNA, okay? Yes, I don't have. So reverse trans. Okay, fine. Complementary. Here, what is the function of this complementary DNA? Okay, it enters, it integrates with the host cell. It integrates with the host cell and stay inside the host cell for a long duration. So it is very difficult to eradicate. Example is retrovirus. Okay, reverse transcription is a method of producing a complementary DNA. Complementary DNA, it enters into the host cell, it integrates with the host cell genetic material, and thereby it stays inside the infected cell for longer duration, and thereby it is very difficult to eradicate. Yes or no? Once it stays there for a longer duration, again it becomes a task to eradicate the virus. Yes, that is your reverse transcriptase enzyme. So, our drugs are reverse transcriptase inhibitors. Okay. Okay. Under this you can find that enzyme, reverse transcriptase inhibitors, enzymes. You have various drugs. Okay. Once it is put it in your server, you can go through the drugs. Okay. Here it is in the white background. So, you can go through the drugs. Yes. Reverse transcriptase inhibitors. Okay. It is an antiretroviral drugs. It is a nucleoside analog, reverse transcriptase inhibitors, activated in the cell by addition of 3 phosphate groups to the deoxyribose nucleotide reverse transcriptase. So, when you add, you get a triphosphate, again there is a phosphorylation, incorporation into viral DNA, prevents nucleic acid, preventing production of new viral DNA. This is the mechanism of action of antiretrovirus. Okay, reverse. Yes, almost, because there is a conversion of triphosphate, monophosphate to triphosphate, which terminates the elongation of DNA and inhibits the DNA. Most of the mechanism of action, only the initial steps varies. Okay, rest it remains the same. Nucleotide reverse transcriptase inhibitors. Yes, this is also this, HIV RNA reverse transcriptase, HIV DNA, it infects the CD4 cell, cluster of differentiation cells, thereby the count decreases and you can find which stage he or she is in. Fine. Antiretroviral drugs, here you can find nelfinavir, sacunovir, intinavir, ritonavir, all ends with VIR. Okay. Yes. Inhibits viral fusion, preventing viral replication. Newest classes of antiviral drugs you have got, example enfuvetin fusion. Okay, new class of drugs which comes under antiretrovirals. Fine? Yes. Combination of the multiple antiretroviral medication. So, we go for synergism treatment. Synergism is nothing but combination of, yesterday we have seen proton pump inhibitor with histamine antagonist. Similarly, here also you go for a synergism. You add 2-3 drugs, you combine 2-3 drugs to inhibit this retrovirus. Yes, it monitors, you need to monitor the signs for any opportunistic disease. You need to monitor whether they get any other disease along with that. Adverse effect vary with each drug and may be severe monitoring for dose limiting toxicity. Okay, you need to limit the dose so that there is no toxic effect. Okay, you will be learning lethal dose, effective dose under pharmacodynamics. Adverse effect, it varies with each drug. Drug therapy need to be modified because of adverse effect. Goal is to find the regimen that will best control the infection with a tolerable adverse effect. Yes, the adverse effect should be less so that your goal is achieved. Okay. Infection with a tolerable adverse, medication regimen changes during the course of the illness. Based on your counts, the medication regimen will change. Okay. That completes your antivirals. Okay. Shall we see from the first what we have seen? we have seen what is a virus, yes, and we have seen what are all the types of virus based on the size and shape and the genetic material. And next comes the structure of virus. It contains a genetic material, protein coat and a lipid coat. Then 2 cycles, viral life cycles, lytic, lysogenic. Then comes, we have seen what are all the antiviral therapy, that is, you have for CMV virus, you have for herpes virus, you have some antiretrovirals also. Then we have seen where the drug goes and acts. Okay, various drugs acts on the various stages of virus. Yes, first some drugs act on the adsorption, where the virus attached with a host cell. Some drugs acts on the uncoating of, then some drugs acting on the protein synthesis, then integration of genetic, then late protein synthesis, then release of the virus. Okay, you have certain drugs which acts on various sites of the virus. Yes, then we have seen example for DNA virus, RNA virus, reverse transcriptase. We have seen herpes simplex virus, we have seen virus 1, virus 2, then hepatitis N, then influenza virus we have seen, then retrovirus, which comes under reverse transcriptase. Yes, reverse transcription. These are all the things. And what is the mechanism of action, how does it act, what are all the side effects. Yes, now last one is antiretrovirus. We have seen what do you mean by reverse transcription, what is this reverse transcriptase enzyme, which is nothing but it causes generation of complementary DNA which integrates with a host cell and stay there for longer duration, which is difficult to eradicate. Example is your retrovirus. Then we have seen cluster of differentiation, what it is, and based on the CD4 count we can detect the stages of HIV. Okay, or herpes simplex, HSV1, HSV2. Yeah, removed for the ACs. Clear? Yeah, 1 minute. 1 minute. Yes, Pooja, clear?
Yeah.
Yeah.